now. Yeah. All right, I couldn't. All words. That's what they need. It was. I mean, good morning, everyone. Thank you for being here. We're going to go ahead and get started. We'll start with our usual introductions, and I know we have several people on the phone. So why don't we go ahead and let's maybe do you mind asking the folks on the phone if they're able to unmute or at least speak into their devices and tell us who they are.
Yeah, it looks like both Ashleys are self-muted, so if you want to unmute yourself and introduce yourself, that'd be great.
I have to design this time with the sound. Yeah, we need to. Oh, she's typing. It looks like, or she's speaking. Yeah, she's typing. Can you read what she
I can't see it.
Oh no. Okay. Ashley, so she doesn't know how. Ashley Alquist, she's Draper, telephone coordinator. Okay. The other Ashley Barney, do you want to tell us again who you're with? I can sort of read it quickly on my screen if the chat comes up. We're using a couple of different computers this morning, so there's a learning curve. Okay. Okay. Is there anyone else? Let's see. Care coordinator at UC Valley Pediatric. Great. Thanks. Okay, I think there's probably a couple of other people on the phone. Anyone else like to introduce themselves?
Hi, I'm Melinda from UC Valley Pediatrics Tinoga's office. I'm the care coordinator there.
Good morning. Anybody else? There were a couple. Maybe that's all. That's probably all for now, so that's great. Okay, terrific. Well, I'm Mimi Tuller, and I manage the Medical Home Portal, and I'm the one who facilitates this group. So again, thank you for being here. Hopefully the drive wasn't too bad this morning. What, Pat?
The parking lot is completely full, so we're driving around.
That was an issue today. Interesting. Yeah. I'm so sorry. I wonder. Okay, we'll see if we can follow up and understand what was going on today and how to handle that for next time. Okay, and then Dawn, do you want to tell us who you are?
I'm Dawn Bentley. I'm one of the QI coaches with UPIC.
We don't have Gabby here this morning. She's in Europe, having a good time. Yeah. So give her a hard time when she's back. Rachel?
Rachel Blaffer, I'm Rachel.
Pat Rose, Select Health Insurance, Pediatric Care Manager, and I brought cards today. So, okay. And also, if you're with Intermountain Healthcare and you're starting your process of pediatric care management home portals in the offices, I would love for you to take my card because we're doing a pilot program with primary children that Rachel's probably familiar with, and I just would like to get to know people a little bit better.
Great. Okay, terrific. Liz? Liz Wells, I'm a pediatric.
I'm Sylvia White. I'm Summit County Health Department for Intervention Program.
Welcome.
I'm a medical home with these girls.
Fantastic.
Stephanie Frisbee, Summit Pediatric, care coordinator.
Department of Health, Integrated Services Program.
Canada O'Hara, the care, I can say that now, one of the care managers at Memorial Pediatric.
Yay!
I'm Kendra, and I am the other care manager at Memorial Pediatric.
Well, that's fantastic. Well, welcome. Thank you. Christina, the care coordinator for the university. Yeah. Good morning.
I'm the care manager at the current site.
Great. Good morning. Tina. Tina Poland, I'm the family. Hey, I'm the medical home portal. Larry Lester with the university. Welcome.
Very nice.
Yeah, fantastic.
Eric Christensen, I'm a very integrated services in our department of health.
Wonderful. And Colin's going to be presenting for us. Great, okay, well, so I have a couple of slides about an announcement that we're excited to be able to share with you. So, some of you might have heard us mention this before, and if you have not, it's kind of complicated, so bear with me, and if you have any questions later, I'll be happy to talk to you, but I don't want to get into too much detail right now. But Dr. Norland has been working on a project called the Pediatric Patient Summary for some time now. And in order to expand that work, he and a number of other partners, including the biomedical informatics group at the university and UCCCN and Intermountain had submitted a proposal to the federal government for some funding that is supposed to leverage health information exchange and really help with meaningful use. And so that proposal was approved at the end of August, and that means that this project is going to go forward to create an app that is basically a synthesis of all of the relevant and timely information for typically chronic and complex patients. Children is the focus of this particular proposal, to kind of distill that all down to an electronic way for the care team and ultimately the families to curate that data and then share it. And we're excited that the CHI, information from the CHI will be available, if it's in the CHI. And also we'll work with EPIC at the university as the first EHR to plug this into, and also ultimately Intermountain. And we're really excited that the home portal information will also be able to be integrated and pulled in a variety of ways as well. So we're going to work for the first period of time, which is 3 years, with EPIC and Intermountain, but our hope is that this will be something that can scale to other EHRs in the future, and also other states, we hope, that would have their own health information exchanges. So we're excited. What we hope this will allow caregivers, the care team, et cetera, to do is to really have that information that they need without the stuff that can get confusing and overwhelming, especially if you've got a chronic, complex kiddo who's got just years and years and years and years of history, when you just really need that stuff that's timely right now. And so that's a lot of complex activities that are going to go on the next 3 years in just a nutshell. But again, we're excited about this, and the medical home portal will be a big part of it. And so what we hope to see is a lot of great improvements in the medical home portal as well. So it'll continue to stand alone, but also to be app. And then another announcement I wanted to let you know is that we've been working on a major update to our Rett syndrome module, and so that should be done, fingers crossed, this week. So we'll send out a little announcement that that's been updated, but you should be aware that that's coming. And then I just wanted to remind everyone, we haven't mentioned this for a couple of meetings, and so we'll be sending out to anyone who's new in the last little while. We don't want to overwhelm new members to UCCCN. We usually give them a meeting or two. But we have a policy about sharing contact information, and so we ask you to read that over and agree to it, and then we'll add your contact information to our shared directory, which allows anyone who's agreed to that policy to see each other's information, and therefore you can get in touch with each other. And so then we'll also send out a little reminder to the overall group of how to do that, because we haven't done that for a little while. So that's the way we make sure that we aren't overstepping any bounds by giving your contact information to each other, that you've given us your permission to do that. All right. now, this is the time when we're able to kind of let you guys have the floor and talk about anything that's kind of stumping you, any that you could use some help with, some brainstorming from the group, sourcing as it were. So if there's anyone who would like to step into the spotlight for just a second, this is your time. Additionally, if you don't have any issues that you're working on right now, but you have some wins that you'd like to share with us, that's also what we'd love to hear. If you've come across some new resources, if you've had any QI wins, any motivational interviewing wins, we love to hear those too. So, the floor is yours. Anyone have anything they'd like to share? And folks on the phone, if you want to type in, I think we can see that as well. So please don't be shy. Okay, Alex.
So I have a 9-year-old patient, and she got into this habit of pleasuring herself at school. And it's been a big issue for this family. And I talked to mom yesterday. She said that there are parent volunteers who have become uncomfortable with this and have reported them to Child Protective Services.
Oh my goodness.
And she just wondered what other resources there were. She's planning on getting time with a therapist. She has a psychiatrist for other like mood disorders and stuff, but I don't know if there's anything out there to help them.
Okay. So this is anyone had any sort of experienced something like this before? Gina's sort of on the cusp of saying something.
Well, not necessarily resources. We've had some of our own children and, colleagues' children, this has been an issue. And so there's some, like, suggestions and such that have come across. Now, it depends on the child and their unique situation, but, like, for one of our young boys, they've gotten to the point where they've had to have almost like onesies made, and that helped with some of that. And then part of the issue is because it's such a sensitive piece, people aren't educating. And for one of our colleagues here, they have really been able to find somebody that works with them. And even for this girl, she has intellectual disabilities, they've been able to help defer and say that there's an appropriate time and place for that, which is only her bedroom. And that's the hard thing to get to because everybody wants to just say this behavior has to go away. It's our same saying as our children are still sexual beings. And so we really did find a great therapist in her area that is helping with that, and it has cut down tremendously on the behaviors at school.
Would I be able to get that therapist name from you?
Yeah. I don't yet.
Okay.
I will ask her and
Okay.
have that share.
Thank you.
I'm not able to quickly go to the mental home portal, but sounds like this might be a case where a direct referral to a therapist who's already had some experience and positive experience, and that would be maybe helpful. But yeah, that is really tough. It sounds like there's an education piece that needs to happen there, and the parents are probably already in a place where they can't take on one more thing. So it would be great for someone else to step into that role, and I don't know if the school is equipped to take that on. I mean, would that be something that a parent consultant could help bridge with that school?
Yeah, they can definitely look at doing a behavior plan. It's a little tough for schools with that particular behavior, but it is a common theme. And so, yes, they definitely call it a consultant here as well. And they also give all of the ideas and such that they have worked with other schools or school districts to see if, one of those suggestions may help this particular family and child.
I heard something coming in this morning on the radio about there being a deficit of school nurses in Utah by Oh, the number was astounding. So I don't know that this is necessarily a school nurse thing directly, but it just highlights that our schools don't have the resources that they need. So this makes a situation like this even more difficult. Well, numbers have grown just a little bit. So welcome anyone who has just joined us. Eric.
I just wanted to throw out a resource, and some folks may be aware of this, and they don't know how many of your families travel from far distances to come see specialists. But University Medical Housing is just over other side of 215 on North Temple. It's an old hotel that the university has been able to lease, and they partnered with the owner of the hotel, and they're refurbishing this to make it be a really kind of comfortable place for people who have to travel for university medical type appointments. But that includes Salt Lake Regional, primary children's, so it's kind of a wide group of folks. Met with them the other day, and they were incredibly nice. They will bill Medicaid rates for a family, which is a very plush $50 a night. But this is probably a lot nicer than you can get for other $50 hotels. The opposite, if you let folks know in advance that the family has issues with food or they're really struggling with nutrition or things like that, they'll make sure they have some sort of a food package available for the family. The food, the Utah Food Bank makes it delivered to them 2 times a month. The manager chuckled and she said, any nutritionist would probably be appalled at some of the food that we give out, but you know, there are things like Hot Pockets or stuff you can heat up in a microwave, and so they'll try to help families out, you know, to get some additional food. Medicaid is not great at reimbursing on food expenses. It's almost like hotel and food is not a $50, and so you're really hard pressed to get that sort of thing. Also working with Internal Health Bureau to try to make arrangements for some of our families who would travel to Salt Lake clinics, and the family may not have Medicaid that they could bill us directly. The hotel could bill us directly, so families don't have to have that initial cash outlay. My sense was if anybody wanted to work with university medical housing, they would be willing to work with organizations to try to cut a deal or bill directly or whatever, so families didn't have to have that initial cash outlay. So I just got the sense that they were really bent over backwards there to try to really make families comfortable and included.
That's fantastic.
They said, too, they try to get families out of the rooms at night, so when you football game night, they'll have the TV going and popcorn and snacks. They do provide a hot breakfast in the morning. And then again, there is kind of this also ready pantry downstairs where folks want to go grab something. They can go grab something. So it's a nice option if you have families who need to travel to Salt Lake for some medical care. You do have to verify that they are being served through university facilities, but most of those patients for whom it's from children.
Okay.
Oh, yeah.
And
yeah,
they provide.
and they do a shuttle. They do some shuttle stuff as well, but they are right on track.
Okay.
They're just the nicest people I think they ever met. Really great folks.
Excellent.
I see that about everything.
So, to add on to that, I was kind of surprised how many families, even the frequent flyers in, that have to do extended stays in primary children's hospitals. Because a little bit of a financial issue because they're away from home and providing food for at home and at the hospital. There is a Forever Young room where there are organizations, people that provide food. There is kind of like the pantry. And I was really surprised that many of the families that didn't know they could go up there and, you know, have a little bit of a break away from the room for a minute and actually have some real food.
Forever Young room.
That's in the hospital.
Great. We'll make sure that those are listed in the meeting summary, the resources of the monthly mail that we send out tomorrow or the next day. Great. Good. Thank you, guys. Always like hearing those kinds of things. All right, anybody else? Anyone on the phone? Anyone want to talk about any wins you've had? Anything interesting going on in your practice? All right. Well, with that, I guess we can turn the time over to Colin. We are very appreciative that he's here. Get back to the slideshow. Worst case scenario, it won't be in slideshow mode, but your slides are in here.
All right.
But I think it's just running just a tiny bit slow, and I've clicked slideshow, so I've learned already if I keep clicking, that's not good. So it might just pop up in the slideshow mode, and then, but otherwise you should just be able to advance. Okay.
We'll roll.
Okay. All right. Great.
All right, that's me. I'm Colin Kingsbury. I'm the Autism Systems Coordinator for the Bureau of Children with Special Healthcare Needs. I know most of you already, but here to tell you about kind of the change in my program and where we're going from here and on forward. Okay, so the mission of the program is to advance, educate, and empower the lives of those affected by autism spectrum disorder in the state of Utah. I have some annual performance measures, and as a program of one, these all fall on my shoulders. One is to analyze current data collected by URAD and disseminate that data throughout Utah. I'll tell you guys a little bit more about URAD a little bit later. And also to partner with Utah Autism Initiative to identify systems gaps and address needed improvements in services. These are the four components of what I do. So Utah Autism Initiative, Utah Registry of Autism and Developmental Disabilities, data system integration, and autism spectrum disorder resource management. Okay, first thing about this is UAI. So UAI has been around for a number of years. It's basically experts from the field who get together quarterly to discuss problems with people accessing services, things that need to be addressed legislatively, and we created a state plan to try and help folks with autism in the state of Utah. Gina is a big component of this. She helped out with the state plan. Eric helped out with the state plan, kind of moving things forward. What we found when we put together this state plan is that there are a number of areas that needed to be addressed, but we kind of focused in on two. One of which is screening with the MCHAT-RF, so that's getting kids of 18 and 24 months screened for autism. Really easy to do. You guys have ever seen the MCHAT? It is 20 questions. If you don't need the follow-up, you're done. It takes 2 minutes. Starting out, we talked to folks and they would say this is the role of the primary care physician to do this. So they didn't want other folks doing the MCHAT. Looking at some old surveys that the Department of Health did, we found that folks who went to primary care physicians weren't getting this done. Primary care physicians generally didn't have time to do it, and a lot of them, especially in rural areas, would fall back to, I can tell, you know, if it walks like a duck, quacks like a duck, it's a duck. And in the data from URAD, what we found is that 44% of kids who were later diagnosed with autism got an MCHAT-RF. When you think about that, that's really terrible. Only 44% of kids who were later diagnosed with autism were screened for autism. This is, in my opinion, why our age of diagnosis for ASD is still one of the highest in the nation. In Utah, we average 50 months for a kid getting diagnosed with ASD. Colorado, it's like 42 months. So they're beating us by a significant margin. And they screen with the MCHAT one. So it could be why. Another area we wanted to focus on is transition to adulthood for people with ASD. So this is starting at 14 years old, moving into, you know, is my kid going to need to be in somewhere like Matt's place all day? Or are they just going to need help at school? I call it. You know, could they be in the Passages program? So there's a wide range there of services that need to be handled because, you know, autism spectrum is, as you know, a very wide disorder. Next, we have URAD. So if you have ever seen prevalence numbers for autism in the state of Utah, they were compiled by URAD. What URAD does is it's through reporting to view the chronic condition that URAD goes out and it queries health providers for all the 299 or F10 code, now F10 codes for autism for a certain year. So we'll say how many 8-year-olds born in 2004 have autism in your medical facility. They send us that info, we clean that data, and that gives us the prevalence numbers. Those prevalence numbers have gone up, and most recent prevalence numbers were actually released last week. They're 1 in 50 now. These are a little bit different. The CDC numbers was actually review medical records. So those numbers are a little bit higher, but those URAD numbers are creeping up to match those CDC numbers. And what I expect is we'll see a plateau in those numbers as we saw in the CDC numbers. While we're late at diagnosing autism, we're actually really good at finally diagnosing autism. So, you know, 1 in 60 to 1 in 50 probably is your true number. You're looking at 2% of your population has ASD. I think this next one is data system integration. Okay, there we go. So this is looking at data system integration within the Bureau of Children with Special Health Care Needs. So how does Baby Watch early intervention and their data match up with the URAD data? What kind of trends are we seeing when we look at, you know, kids in what associated features are in VTOTs or that Baby Watch is seeing, and you know what's being later borne out in the other types of data. We've worked with Salt Lake, Davis, and Tools to give them their prevalence numbers. You know, that gives them a handle on how many kids with ASD they can expect to see in their district any given year, how those resources need to be laid out. We've worked with the University of Utah, Huntsman Cancer Institute, Utah Valley University, Brigham Young University. I'd like to highlight the University of Utah here because they recently did a study looking at magnesium levels during pregnancy and whether that had a protective effect on kids being born with autism. It did not. It was just one study, but, you know, it's okay regardless. You know, when you're doing these research projects, you all hope, hey, could chocolate help me when I'm pregnant? You know, it helps you feel better. So that's a win in itself. You know, we're now doing another study looking at suicide rates. You know, are there associated features within autism that lead to a higher numbers of suicide? This is obviously a big problem in our country right now. And, you know, there's a couple school districts that have said we want to know more about this. So we're starting a study looking in that direction. And finally, and probably the most pertinent to today is autism resource management. So while I don't do care coordination like these folks do, I do get a lot of calls for kind of, I like to call them weird things. So get a call, hey, I don't know what to do with my kid during the summer, what summer programs are available. My kid really likes LARPing. Do you know if there are any LARPing programs? LARPing is live action role play, and I do know, not because I'm a LARPer, but I got calls, it's been, it's been kind of fun to find those things. So it's a wide variety of things that I get a call for that aren't necessarily care coordination. We do keep an ASD diagnostic providers list on our website, mainly because it's easy to read for parents and it's something you can get to them quick. We always refer to the medical home portal because that information is updated more regularly. There's a lot more information and it gives parents a lot more choice in where they want to go. But for certain parents, this can be a down and dirty, quick thing to get to them. To show them basically there are resources available. Whenever I send parents with this diagnostic list or a list of places to go, I always send them with a proper care coordinator, which I help, tell them follow up with these people, integrated services, for example. That is kind of my quick overview. The last thing we did, and I kind of mentioned this earlier, is a needs assessment. So once the needs assessment just covered screening, transition to adulthood, and wait time and assessing into an evaluator. This is actually evaluation with giving parents options and working with them has really kind of cleared up, which is great. So parents are able to get into an evaluation a lot earlier than in the past. That's a big win, and it's something that just kind of happened naturally. Screening is going to take a lot of work. We're really going to have to either get primary care physicians to fit it into their 5-minute session with the kid, or convince other folks that they can do it too. Where I think we're headed with that is probably the digital world. New app out called Baby Not, which I heard about on a HRSA call, and it's an app a mom can download. She puts in her baby's data, and it will remind her, okay, 18 months now, time to do an app chat. And my understanding is within the app, you can actually do the screener, which if that's true, that'd be great. There's also mchat.org, which parents can go on and do an mchat that in there. Baby Noggin. Noogin.
All the way over.
And then we're also, again, transition to adulthood. I think the biggest key with this one has actually been the Autism Council of Utah. They've put out several grants to address services for folks, turn 18, and honestly, that's because most of the mothers in that group have kids who are now of that age. So it really takes a mom who's going through that to know, boy, we need help here. And there's a lot of great programs that come out of that. Peer connections with Janet Wayne. I know Janet's not here today, but they do incredible work, and I always refer to them if possible. If you set up a and see her folks at the Leonardo, they're part of the Peer Connections program. You will meet a teenager with autism, and you will not know that they have autism. I met this kid, and he gave me a tour of the Leonardo, and he was less awkward as a teenage boy than I was. And it was just, sometimes you need a little smile when you're doing this work, and they just smile. That's about it. So, if there are any...
You know what? I'm on this conference call here.
I appreciate, this is really a timely presentation. I work for Select Health Insurance, so I don't ever get to lay eyes on the children. All of my interactions with the parents. And they call me and ask me for resources when they're newly diagnosed. But more often than not, when I'm like them and I'm looking, what is the latest and greatest education out there that I can help support getting them immunizations, because there is still a fair amount of resistance.
Yeah, so I would actually say 20% of my time is discussing with parents immunization. And the hardest part is that there is no scientific data that shows that immunizations cause autism. So it's really hard to show that that's not true. That website you went to, you know, Infowars.com or whatever, is not accurate. So you really just kind of have to walk them through it. If you go to scholar.google.com, you can pull up all the research. There are thousands of studies, but you know, once I kind of get into a parent's mind, they don't want to know. I don't have a success story with that. I'm sorry. Unfortunately, this is something that is really pushed in our community, and it's kind of made worse. A researcher at the University of Utah who is starting to push this for her own personal reasons, and it's really damaging the community in a lot of ways, and it's really unfortunate. So I'm sorry, I don't have the answer to that.
So my question is related to transition services, because they do stuff awesome. What are you seeing with these grant proposals? What are people about? Like, do you have any sense of what that might be?
Generally, it's looking for employment. So how do you get them employed? And I'm kind of seeing more from the private sector. The biggest players are the Columbus Center, and they're starting programs to get kids into their hub, the Columbus hub, teach them how to do a job, and then have them go out and do that job. That's where I would refer people to start. You know, like I say with Janet Wade's program, the problem there is that they're all kind of at capacity, so they just need more money. But it is coming. There's also a work program with the ASDC at the University of Utah, which is teaching kids how to work. If they get into Peer Connections, that would be the best one, because they find a job that the kid's actually interested in. So they'll actually meet the kid, work with them, find out what their interest is. They'll say, what's a job you think you might like? Well, my uncle's a mechanic, so I'm going to do that. They find out if they're a good fit for that.
Well, I went to a presentation we have, and they're starting to in that transition. Can you have
Yeah, so obviously both rehab is in the schools. You know, once again, they're kind of at capacity, so everybody's at capacity. So you can refer them to any of these resources. I like to refer to Peer Connections in the Columbus School first, because generally the parents I'm encountering have already either gone through Evoke Rehab, or you know, are kind of ready for something different, or their kid might not even qualify for Evoke Rehab for whatever reason. You know, as you know, with autism, there are several different diagnoses, and some diagnoses don't qualify for certain services, kind of depending on when the kid was diagnosed. PDD and OS, for example.
Yeah, that question from someone on the phone.
Yeah, so Ashley asked, does anyone have any suggestions for getting ADOS testing paid for by insurance?
Will I tell? I don't know.
No, I don't have any good suggestions. It's all very individualized with the patient and what other factors or clinical indications there are. I find it interesting, just in my own experience. I have many children that I follow that have Down syndrome and autism, or they've got a cardiac autism, and that it's associated with another chronic issue. And so sometimes things can get slipped in there. Very often it's the way the screener or the provider codes it. And that's the problem. Well, one of the problems.
There are actually parents who have told me that when they'll do a private pay, you know, Carmen Pingree Center does evaluations now, and they have it's private pay. Autism Spectrum Disorder Clinic does private evaluations, private pay for folks on Medicaid or universal insurance. And when they do an ADOS, sometimes that can be cheaper on private pay than whether they do the insurance for the evaluation.
I can also tell you that rarely, if ever, in fact, I can't think of a time where parents or the physicians have asked for genetic testing associated with autism, where that would ever be covered. Because the reason is it won't change what they do for the child. So if the genetic testing outcome says, oh, this is what we thought it was, we've wasted thousands and thousands of dollars, but it's not a waste for the family. It gives them a sense of closure. We understand that. But just to do genetic testing flat for autism, I don't know any insurance company that would pay for that.
So she, well, one comment was that it's kind of hard here, so if you're speaking maybe, no, that's fine. Speak clearly. And then also she said that she's been told it's about $1,000 for testing, and many families can't pay for it with high deductible plans, and wondered if schools can do any of the testing?
Yeah, schools do autism testing. I don't know of any school that does an ADOS or has somebody qualified to do an ADOS. Generally with the schools, though, you're going to get an autism exceptionality, which isn't a diagnosis. So there's a difference. When you're getting an evaluation, you want to have it done by someone who's qualified and good at their job. Because if you go somewhere and give a bad evaluation, that can really color moving forward what's going to happen with your kid. We can't refer to people. I don't refer to people and tell them these people are good and these people are bad because it's biased. But I always do tell parents, you need to do your homework. It may cost more, but you only want to have done once, and you want it done by somebody who's qualified. It's just important. If you get a misdiagnosis on a kid, all the other diagnosticians are going to look at that and say, well, maybe this person was right. Maybe it is just ADHD. I don't know.
Doesn't the ASCC have the grant fund? You get a scholarship, you can apply for it?
They do, yeah.
To do the testing. I mean, it's not going to cover all of it, but it will cover up to $200 of it.
If they're financially strapped, I recommend calling these places and saying, what can you do for me? A lot of them do have sliding scales. I know UDAC has a sliding scale.
Yeah, I was going to say, UDEC, any university would probably charge less than anyone. And we do pre-op, call it, if they get a bill, they do have financial folks that work with these folks. You need to have a lot less than they do. But my understanding is, if they have Select Health, Select Health is not contracted with UDEC at all. That's the only insurance that is not. So they have to go through that provider. So that's.
I think the important thing on the education piece is some families have received some screening and evaluation. Have to remember it's for educational purposes only to qualify them. It will not help them in getting other services because it is not a medical diagnosis used for other programs. So even if a family is feeling confident because they have some type of evaluation, they really still need to seek out a medical diagnosis because that will help them with the programs they're going to need along the way.
And another observation is when you have a child with high functioning autism and they're not educationally advanced, they may not need any services in school because there's not an educational impact. I have talked to families who have gotten the diagnosis of have the ADOS, they know their child has autism,
struggling in school is not with academics and that really is the 504. So there's both ways, get the medical and then have the education.
Any other questions, comments, or concerns?
I have a question. So it's so great to have you know so much about this. Are you someone that these folks in this room and on the call can call or contact with questions around these resources?
Absolutely.
Okay.
Yeah. I didn't bring any cards today because they're out of date. But if you can send out my contact information,
Of course.
give me a call. I have access to my email more often than my phone. So that's probably the best way to get to me. And then, if any of you guys want to come to UAI and voice your concerns, please do. That's a quarterly meeting. You can email me and say, hey, I'd like to come to that. We'd love to have you. URAD, those are open meetings too. We always invite people to come and see what is the latest research showing? What are we looking into? Come to that. More input, the better.
I did just want to say about Colin. He has been part of our integrated services team for a long time, but one of the things that I found Colin was really adept at doing was working with organizations and trying to get groups like pieces like that, get them to expand their geographical reach because of some of the groups. We have services and we have ABA therapists going to communities or providing services for families in communities where they didn't exist before. So I just wanted to, thank Colin for that. He's done an outstanding job trying to expand that kind of service delivery model to some very underserved communities.
I think that was actually Heather who did that. Heather is the best and better than me. So I'm just going to deflect that compliment over to Heather.
So one of the things that your program is supposed to do is identify gaps in services. And so can we help with that, both by perhaps just attending the UAI quarterly meetings, but also just communicating with you?
Yeah, the best way to help with that would be coming to the UAI meeting.
Okay.
So that we can understand and get a handle on the gaps, and maybe if you guys can help fix them, would be great. I understand a lot of this is not going to be fixed anytime soon. Hopefully it will be one day. When I took over this job, Dinah Weldon told me, you're turning a boat on the sea. It takes a long time. So I think about that probably daily. But yeah, please come. Tell us what the gaps are. Tell us where you think you can help. Tell us how you think I can help. The more, the better.
Just really quickly, for those of you for whom it's relevant, are you doing the MCHAT screeners? That's nodding. Anyone not doing the MCHAT screeners where maybe that's something that could become part of the workflow? So this group is pretty much on top of that part of it. Okay.
To a little anecdote to tie that in, I remember Heather and Tony and I were in Vernal, and we went to a pediatrician there and we said, do you do the MCHAT? And they were like, what's that? So that was just, that was kind of where we're at. And also, what's an IEP?
Yeah. And so some of the gaps certainly good evaluation, so enough in reducing that wait time, but also maybe helping parents to pay for those out of pocket or to connect them with funding sources that could help with that. Hope grant is one that we can do.
Yeah, and pretty much all these places, the bigger ones have a grant or a sliding scale that parents need outside for. It's paperwork and it's hard to do, but they are there.
So it's also just helping parents advocate for themselves, say the right words at the right time. Yeah.
Online and
Yeah.
literally.
And so the medical home portal certainly has a lot of information about ASD on it. I just wonder if the immunization piece is something we could ask for one of our expert authors to help tackle in a, kind of maybe a little separate part on the portal.
I'm a public counselor, so does immunization.
Great.
So, in my experience of 20 some odd years, I find that in doing a one-on-one with the parent tends to help, letting them know that they have choices where it comes to immunization, so that they can actually begin to pick and choose, and discuss with them what would be a priority, like hepatitis A, if they're going to eat out, tetanus, if the kids are playing on gym equipment. So we start with the basics, and then we work from there and let them know that they're in control of those immunizations, in the fact that they can work with scheduling, where a lot of them feel like they're inundated too much too soon with too many immunizations. So we give the parent as much control as possible, and that is to help. Plus, we've got tons of literature through the immunization, immunization.
So that actually brings me to another question then. When you talk about the MCHAT, and I'm not familiar with that because I've only worked hospital-based pediatrics, and now I do that stuff. But the screening you do for this is at 18 months. Obviously, there was a conscious choice to do it at 18 months, but why not? I mean, what's the difference between a 12 months and 18 months developmental progression that would stop you from doing the screening sooner?
Well, it's actually so it's 16 to 30 months.
Okay.
So you can do it any time in that range, but it's just recommended at 18 and 24 months because some of the kids are supposed to come in. So it's just built in to be a part of those visits with the pediatrician. If you're 12 months, you're probably going to fail the MCHAT because of the questions on it. Does your kid look very point or something? The baby might not do it that. But it is also recommended if your kid fails at, like, say, 16 months, I think the AAP says wait 4 months and give it to them again, see if they fail again. And a lot of kids don't. The MCHAT is kind of seen as the gold standard. I think it's 91% accurate, which is excellent for a screener. And you'll see it, go online to mchat.org and you'll see it. It's really 20 questions. Yes or no questions that they can answer. So it's true.
Developmental-wise, 18 months, they're developing speech. A lot of autistic kids will get to a certain point, but they actually regret in their speech, which is a key point for us. A lot of them will not respond to the names at 18 months. A lot of them will not have that point factor. And those are, for us, kind of key points that we pick up on.
So what was the perfect, the wrong word, but what would the ideal scenario look like for a child with ASD being diagnosed with ASD? At 16 months, 18 months, the MCHAT is done and it fails, and then they get in for an evaluation with a high-quality evaluator.
Yeah, so I think that they say they can do an accurate diagnosis somewhere around 2 years old. Speaking with someone and the psychologist, I don't know necessarily if all of them are comfortable with that. So that part is kind of above my pay grade, if you will. I would think if a parent can get that kid in before 36 months, do the MCHAT, you can have them screened, you can get them an early intervention, and then maybe after 36 months, for an evaluation. Good solid evaluator, get the AS done, get them, and then at 3 years old, you can get them into ABA therapy. I forget if it's private insurance or Medicaid. One of them starts covering at 2 years old for ABA, and one of them starts covering at 3 years old. Most of the ABA providers in Utah don't actually start taking kids until they're 3 years old anyway. So you kind of got that early intervention piece, which is really the most valuable piece, and that's the one that actually has the most literature and data backing.
And Medicaid has a waiver for autism, so they're actually making it up to 2 years old for it.
Right, well, so the waiver actually sunset, so Medicaid insurance covers ABA therapy, and I think it's 2 to 9. Once again, I forget if one of them, private insurance is 3 to 21, and Medicaid is 2 to 9, or I guess the opposite.
Medicaid.
I know that Select Health covers stage 9, but they're redoing the policy because they just need to. And I know that they're going to extend the ABA beyond 9 years now.
Yeah, and on that note, SB 57, which is the bill for insurance companies to cover ABA therapy, is going to need to be re-upped. So that would be sunsetting. So if you have a congressman that you would like to call and tell them that they need a vote to have that re-up, because it really helps a lot of people do that.
What's the bill number again?
SB 57 is the one that's currently.
So the question in my mind would be, if you've got a parent who is aware of, you know, the prevalence in Utah and concerns potentially with their child, what if they're going out to mchat.org and doing the mchat for their kids, like, daily? I mean, I hear that they fail at 16 months, but sometimes at 20, they're good. I don't think it's a positive thing for a parent to maybe have that app or that website if they're overly anxious, right?
Yeah,
Is there a fine line there that?
I don't know if you could help that parent curb those tendencies regardless. I mean,
I think with my son, I did that because he was not taught, he was nonverbal. And my pediatrician, we never got the MChat, but it was just my, like, no, you're something's not clicking with you. But it was, and the MChat at that time, he's 12 now, it really wasn't huge. But it was because that I pushed. The pediatrician was like, whatever, you do whatever you want. You know, I mean, he was literally like, the kid's fine, he'll catch up, is what he was saying. And I feel like some pediatricians are like, they'll catch up. So I have that other, like, if you're worried, because parents know, parents look at them and go, he's not putting anything in his mouth, he's not making eye contact, like, they know. And so I don't think it's necessarily a bad thing, but they're going to have that pediatrician that just doesn't, it'll be fine, just keep checking, they'll be, you know. So I don't know if you're ever going to, I know I didn't. But that was just because I knew.
And I think you get both ends of the spectrum, where you have overly zealous parents, and then I'm going to tell you, my sister poo-pooed the whole thing, even though my wife and I were both kind of pushing, don't talk to me, three. I mean, we were kind of pushing this whole thing, and we just didn't have to be interfering brother and sister-in-law. And finally, someone else said, you know, you keep pushing for, and he's got some, that is all of a sudden red flags. Well, then my sister said, oh, I get it. So I think you can only get the people who poo-poo everything, and especially when it's coupled with the pediatrician that, although, it's really tricky. So I think it's, you get both ends of the spectrum. Well, that was an interesting term, I think. With parents.
I also want to contact as far as parents who want to know where their development using stages, social emotional, helping help to grow, and they will send out those questionnaires. And they can stay on top of the development. So if they knew about that, looking at the help to grow, just the ages with the developmental one, there's also social emotional. And when those start showing red flags, then the master's in the so that's a good resource.
Any other questions, folks on the phone? Let Colin go. Colin, thank you so much. We'll make sure Colin's contact information goes out in the email that you'll get. And if you don't see that or can't wait, just contact me. I will get those to you. So thank you, Colin. We really appreciate that. Thanks that the folks on the phone haven't been seeing anything on the screen, which is, I think, okay, because we were at the point of just talking. But I don't know. I'm not sure if I'm going to be able to fix that, to be honest. But there's only one more slide, so hopefully that's all right. And we apologize that you've been hopefully hearing us only. I hope you were able to hear all of that. We'll capture everything in the notes. So, you guys, we're done early. Oh, Paige, yes.
Well, I've heard about this new Autism Center, connected with UVU, is that right? Yeah. Does anyone know about it? I looked at their website and I don't really get it.
No. Maryland has been going down a couple of times a month to try to do some care coordination for families in Utah. And so they've given her a lovely space, right? Well, there's not a bad space in the whole building, but they've given her a nice space to
So it's a center mostly for college students. However, they try to expand their services to be able to serve all of the children, everybody in the community. And the reason they asked us to be care coordinators is so that expands into the family. So they have a packaging program there, which is for college students or transition age kids. They can come and take classes through the packaging program, and they don't have to be enrolled at UVU. If they are enrolled at UVU, it's a place for them to land. It's a place where you feel they can be successful in their college courses, and they can socialize. And they have a really lovely building and an area where they can come, and they also have been peer there for the students on the spectrum. They have a preschool that they have contracted with Alpine School District to have a class there. And then they are teaching the students there in special education. So they're bringing some on-campus observation, participation in a preschool program there. But they have to be part of Alpine School District, and that is arranged through them for the kids on the spectrum who are in the preschool. I saw recently, and I haven't talked to Laurie Bowen, who's in charge of all this yet, but I saw that the Autism Academy in Warren also has a classroom there. And I don't know if both of them use, but it's not a place where you can go testing done or anything like that for certain ages. It's geared towards students be successful in college and teach special education how to work with autism. So and then they ask us to come and do for anybody. So we started by having if you don't have people studying.
And it's not like you need to just like a walk-in or something right now. It could be down the road as more work gets out, but right now it's back.
And it's not individual studies for people. Like, hey, you know, it's right there with the room where the other professors are, you know, in the hallway, and you wouldn't go in that building unless you had a specific reason to. So it's coming there. They want to serve the community. They also have a library there, that anybody. But no ADA training. No. That's cool. Well, I don't know if that's one of their courses in their, I didn't look at their college.
They do have
Do they?
a course for PCDA, for ADA, but they don't offer ADA tests. There are a lot of ADA providers.
So we might follow up with Marilyn to make sure we're clear on what the services are.
And I am doing this now, but we just hired our lovely, Carrie Martinez, who's good. Oh, so, it's not me, Carrie. In fact, Carrie's in the.
And I know you're reaching out to, Teresa Hardin, who's our director, or Lori Bowen, who's kind of the administrative side of things there. Either one of them was her name.
Laurie is the outreach person. But not a review.
Okay, great. Well, we'll make sure that that's on the home portal correctly, all the good stuff that they do. Great. Okay, well, so our next month's meeting topic will be, we kind of done this annually, and we're doing it again this year. The Utah Asthma Program will come and talk, and I think we'll also have representation from Salt Lake County's program and maybe beyond that. So we're getting that all worked out, but Brittany Guerra will be here for sure, and we'll look forward to what they've got going. They've done some expanding of their program. I think it'll be great to hear about that. And then I just had a question for you guys. I don't know that we even have the ability to do this, so take this question with a grain of salt. But I realize that we're seeing folks come a little bit late on a regular basis, and I wonder if our start time is a problem. So I don't know if it's traffic, which might be mitigated by starting a little bit later. Today I heard that parking was a bit of an issue, and that might be something that we can look at. But is anyone willing to say that 8:30 is a good start time or 8:30 is not a good start time? Just want your feedback, because we want this meeting to be for you guys. So if it's not working very well now, we can look at maybe tweaking it. Anyone?
I'm good with it.
8:30 works for Marilyn.
Just because I walked in late, but that's okay.
Well, I'll tell you, I wasn't here for the last meeting, and it didn't occur to me that the school zones would all be going today. So that caused me some problems this morning, and I don't know that you can get around that. There are very few surface streets to get here that aren't going to have the 20-mile-an-hour zones. So I just needed to start earlier today, and I will do that. But everybody else, 8:30 still okay? Okay.
Accident, which you can't, it's not a good idea.
Everybody Okay, great. And then for those of you on the phone and really anybody in the room, I've been changing a little bit how I get the notification out to folks. We've just started including the GoToMeeting information in that last email. Hopefully we want to encourage people to attend in any way that works best for them. And so now that we've got a couple of solid things funding-wise in our pocket, we're going to look at maybe trying to augment our audio a little bit so that experience is better and our recordings are better. And so we'll try and keep continuing to improve both communication and technology to make sure that this meeting is at least accessible for everyone. But yeah, if you have any concerns with anything about attending the meeting, please let me know, and we'll continue to try all the time. And thank you to everyone who took the Pediatric Care Coordination Survey that we've been giving you and bugging you about. So we've gotten quite a few responses on that, and that's very helpful to us. So great, well, we'll let you go a few minutes early. Please eat some more food, and then we'll plan on seeing you October 8th. I will get your validation. Oh, yeah, Gina will get your validation, so. Yeah. How are you?